Hello, and thank you for joining me on my presentation about Guillain-Barré syndrome. So, Guillain-Barré syndrome is an inflammatory disease of the peripheral nervous system. And what happens is cellular infiltration of leukocytes and other large cells will be responsible for demyelination. And if you're unfamiliar with what cellular infiltration is, it's basically the migration of cells into one specific area. And with those cells being leukocytes, I'm guessing we can assume what could be going on. So demyelination will acutely distribute throughout the whole body, starting at the lower extremities, making its way proximally up into the upper extremities, eventually innervating the facial muscles and the tongue at one point. With other severe cases, it can also distribute the respiratory system. Now, this disorder is not hereditary nor contagious. However, there are possible triggers such as influenza, food poisoning, and certain vaccines that can expose you to this disease. So the symptoms that these patients will demonstrate is an onset of symmetric limb weakness. Again, this is an acute attack on these nerves, so patients will experience weakness throughout the entire body, as well as pain despite them being paralyzed. In order to properly diagnose this disorder, doctors will request for a lumbar puncture so that they are able to analyze the cerebrospinal fluid. Now, cerebrospinal fluid content is the strongest way to diagnose this disorder. However, it can be tricky because the protein levels will appear to read normal for the first week while patients are experiencing symptoms. Electrodiagnostic testing is also recommended in order to diagnose the disease. An EMG will monitor any slow nerve conduction velocities as well as any prolonged distal latencies, which just means that there are any delays in the nerve transactions. In further diagnosing this disorder, nerve biopsies will be performed to confirm that there is demyelination within these areas. So nerve damage will occur throughout the entire peripheral nervous system, mainly within the lower extremities, but primarily in the major nerve plexus, the spinal nerves, and as well as being as close to the dorsal root ganglia. Forward to the best practice recommended in treating this disease is plasmapheresis and intravenous immunoglobulin. Plasmapheresis, or in other words, plasma exchange, will start within 4 weeks of the onset of weakness and is reported to enhance functional improvement of mobility within 6 months. However, this will all depend on how many volumes of plasma the individual is given. IG is just an alternative approach that will start within 2 weeks of the onset of weakness, and it's just easier to administer and is widely available, commonly seen in hospitals for a more conservative route. Seeing here is the 7-point Guillain-Barré syndrome disability scale that is ranged from 0 to 6. Patients will see this scale when they are being assessed for treatment reactions or clinical outcomes. They will also be using this to evaluate the patients once they are administered into the hospital, towards the end of treatment, after discharge. Then again, they will be evaluated in 6 months following with a year evaluation as well. As far as rehab goes for these individuals, they never fully recover proper motor or sensory functions and will experience a duration of residual problems from fatigue, pain, and now getting into the more psychological stresses. So exercise programs for these patients will include range of motion exercises, stationary cycling, and walking or strength training that need to be documented daily. Exercises can be performed passively, actively assisted, or active, just depending on the amount of weakness that the individual is experiencing. It is imperative to monitor the intensity of these exercises closely because if you over-fatigue these motor units, it can and will impede the recovery process. In conclusion to my presentation, this condition will occur 10 to 12 days before a plateau has been reached, with the duration of the illness that will last no longer than 12 weeks in patients with a more favorable outcome. It is essential to continually monitor these patients' respiratory status as well as their motor and sensory function. If you have any questions, feel free to reach out to me and I'll be more than willing to answer them.